Welcome everyone. My name is Madeline No and I'm from NetHope. And thank you for joining us today for another NetHope Solution Center webinar. Today we are talking about how COVID-19 is accelerating the use of emerging technologies. We're being joined today by presenters from Sen Health, Drone Life, and Viamo. Before we get started today, I'd like to go over some housekeeping guidelines for the session. Please keep this interactive. Please post your questions and comments in the chat window for our Q&A discussion at the end of the hour today. Also look for a follow-up email that will include a link to the recording for this session, plus any collateral and other information that came out of today's session. And we also ask you to respond to our webinar satisfaction poll toward the end of the hour as well today. Your input and feedback is very important to making these sessions better every time, and we really appreciate you taking a couple of minutes to give us that feedback. And with that, I will turn it over to Sonja Ruetzel from Catholic Relief Services to kick things off today.
Thank you very much, Madeline, and thank you very much, NetHope, for facilitating the sessions with us. So yeah, as Madeline mentioned, we have some exciting speakers today talking about emerging technologies that have been accelerated through the COVID pandemic this year. So we have Joel Uguborogo, the founder from Sen Health. He'll be speaking about AI trends in Africa. Lucas Borkowski, the Director of European Partnerships at Viamo, speaking about gamification and social behavior change communications, and Miriam McNabb, the Editor-in-Chief of Drone Life, speaking about drones and drone delivery during COVID. However, before we get started, I also want to share with you a couple of trends I came across and interviews I had recently with CIOs at various organizations involved in humanitarian aid and development, such as CRS, Oxfam Intermon, IRI, SOS Children Villages, Action Aid, Global Fund, and DAI Global. And I asked them about what key digital transformation trends they have seen this year. And as you can imagine, there are not too many surprises, but I just want to highlight a couple. So of course, the pandemic has accelerated the digitalization of services and processes, but many organizations have already been well in the progress of their digital transformation and implementing or starting to implement enterprise resource planning like ERP systems or other forms of data sharing within their organizations and across organizations. But particularly this year, as you probably all know, we have seen a massive increase in communication tools and conferencing software. And I'm sure you have been in a number of Zoom and Skype and Teams meetings already this week alone. So there's been the biggest challenge to really ensure all the technologies are in place and everybody has access to them, and ensure a possibility for data exchange. But as every year, always the top priority and the top challenge is cybersecurity. And as you probably all know, there have been a number of increased threats to cybersecurity. So that has been named again as the biggest challenge, the biggest priority, and also one of the biggest area of investments in cybersecurity. Across different agencies and all different technologies. And the third trend we've seen is around capacity building. So really putting people first, ensuring everybody is capable to use these digital tools and sharing them through our own organization, as well as supporting our partners. And here we have seen some slightly different approaches. So some organizations are more focusing or particularly focusing on digital skills training for program staff, where others, like for example, Action Aid, is also very much moving their IT teams to becoming leaders of programs with a very high percentage of the high digital component. So we can really see that the boundaries are being blurred between the programming and the IT teams. And not just only increasing the digital skills for everybody in the organizations, but also the programming knowledge for IT teams. And same we see within cross-sector collaborations. So we're seeing a blur of departments and functions and sectors. And that's also one of the reasons why I thought we can talk about different types of technologies today in our webinar. And on our next slide, I have also a couple of ICT priorities and challenges. So as I just mentioned, digital skills and capacity building are number one going forward as well, to really help bridge the digital divide and support our staff, our communities, and the individuals we serve. Number two, there are a number of different emerging tech trends, and the top ones that have been mentioned to me and also are very much in line with what we've seen in an earlier survey we did in April, was the increase of telemedicine, certainly also due to changes in the policies, particularly around AI. So that's why I invited Joel to give us some insights about it. Also a big focus on chatbots, even beyond e-health. Changes in supply chain or innovations in supply chain, which will be a huge topic going forward with the distribution of the COVID vaccination. And so that's where we also want to talk about using drones for delivery. And there has been big changes or big innovations around social behavior change communications. As you obviously have all seen, that's communications that is aiming to change the behavior of individuals or communities by positively influencing the knowledge or the attitudes or the social norms. So like wash your hands, keep your distance, etc. So we've seen a lot of changes here, and that's where we hear more about this from Lucas. And all these really have also a common trend that we're talking more and more about ethical considerations, talking about how these innovations are supporting or maybe even challenging diversity, inclusion, and equity, and the responsible use of data. And I really hope that 2021 will be the year where we are very much putting the ethical debate a step forward. And across all, you can see there has been a lot of acceleration across different levels. So the tech innovations, the people's digital skills, as well as the behavior and ethical debates. And that was just a brief overview. And now I will, without further ado, I will pass on to our experts to give some more insights into those specific emerging trends. So Joel, over to you. I'd like to hear from you your insights about the use of artificial intelligence trends in Africa.
Okay, thank you very much, Sonja and Madeline, for the introduction and the invitation to the platform. Much appreciated. In my discussion today, I'm going to talk about the emerging AI trends in Africa. So I'm going to break it down to three broad areas, which I'll cover. So I'll talk about trends and insights. I will now talk about challenges and opportunities, and then I'll end with way forward and realizing the opportunities. I think we just have about 10 minutes, so I will be brief on most of these slides. Next slide, please. Now, when you look in 2020, that's of course this year, July of this year, in the heat of the pandemic, we conducted a survey, Send Health. And what we did was that we reached out to healthcare professionals in Africa and those in the diaspora. And the whole objective of this survey was to understand and gain an opinion of professionals that are working in the healthcare sector and exactly what they're about technology on the continent. So there were two key insights we got from this. The first one being that healthcare professionals want to understand the opportunities of emerging technology. How can they really leverage this technology, these technologies rather, in the healthcare space? And then secondly, there's a strong willingness to learn more about these technologies. So Sonja mentioned earlier skills and education and training. It actually ties in with one of the findings we found in our survey. So when you look at the insights that I have here, it's interesting to note that when we look at WhatsApp, for instance, which we have 84% on the top right-hand corner, we talk about most people were using WhatsApp to talk to their doctors. It's accessible, it's easier on the continent. It's end-to-end encryption, it fits in. The only disadvantage is integration into your EHR. And of course, most patients don't have a PHR either. But what's interesting here is that this technology leverages AI chatbot technology. We're talking about things like contextual intent as one of the capabilities within that platform. And then we now look at health devices on the other extreme, 69% involvement of people. Now, when we're talking about health devices, IoT devices, we're talking about things like the Fitbit devices, but more importantly, we're even looking at things like your blood pressure devices, which can be connected via Bluetooth, and also your diabetic devices. And what the views of professionals were was that accessibility of these affordable devices by patients and health consumers would considerably change things. And then we look at the area of non-clinical management of healthcare when we're talking about digital scribes, for instance, where you have documentation support, 75%. And then people talked on the question of AI, and when we asked what people felt about AI, generally it ended up at 50%, just a bit less than 50%, but we rounded it up to 50, just point something before 50. And what's interesting here is that if people have the perception that it's a 50-50 chance, it got us thinking that why is that? Because we have the high enthusiastic views on other technologies out there, including telemedicine. So we reached out to a couple of healthcare providers and healthcare leaders and had one-on-one interviews and discussions. And we found out that one of the real challenging things here is understanding the health use cases. What exactly should be done to shift the needle? How do we really get to understand how to go about doing AI in healthcare? So I'll talk about that more in the next slide. Next slide, please. So here we're talking about AI use cases at scale. And when we're looking at the AI use case, there are two key things we look at when we're talking about AI. We're talking about automation, which is a key component of AI. So we're talking about repetitive tasks and non-clinical tasks, improving efficiency. And then we look at augmentation. Augmentation having to do with clinical decision-making support to decision support to the healthcare professional. It's also using imaging, diagnostics, and things of that nature. Now, the three key things that came across, in addition, those were our top three from other things they mentioned, so I'll stick to the top three, were beneficial health outcomes. Now, with beneficial health outcomes, the healthcare professionals are looking at what sort of qualitative terms is AI going to add to the healthcare outcome. The healthcare outcome in particular for patients and for the healthcare providers and professionals. So when you look at AI solutions here, we have to look at it from the viewpoint of obtaining insights into diagnostics, care processes, personalized treatments, but most importantly, we have to look at viable patient outcomes, which leads us to patient-centric care. Because as you may be aware, with consumerism, everything is getting focused on health on demand. And so we're having a patient-centric care sort of paradigm shift, which actually lends us in leveraging AI to achieve that. The next thing is scale. Now, is the solution scalable? And what's the impact on population health in quantitative terms? What sort of benefits are we going to look at in terms of supercharging public health initiatives and health interventions that actually look on a broader scale? And then lastly, I said I'll keep it to the top three, there's a bit more than that. We're looking at return on investment and cost reduction. AI is experimental in nature. So when you're talking about return on investment, it doesn't really follow the traditional pathway of technology solutions where we have all those phase kind of design, analysis, implementation, development, then you move to business as usual, BAU. You have an experimental phase within AI where there's an iterative approach to improving the algorithms of the AI solution. And as you improve it, it gets smarter. Hence, we move from machine learning all the way from narrow AI, moving into general AI, and moving into deep So those sort of things are things that is a continuous process. But what's very interesting here is that there's a willingness to understand this. There's a willingness to get in there, but how do we match the correct cost reduction? How do we map out the return on investment in such a way that businesses, especially healthcare providers, can leverage and really start using this technology? So those were the sort of things that were coming about in the AI use cases. And so what we now did was that looking back and looking at all the things, I'll talk about that in the next slide. Next slide, please. We're looking at a revised approach for sub-Saharan Africa. And in this revised approach, we have 5 key things I'm going to talk about there. But before I start, one of the challenges we have all over in any healthcare on the national level in healthcare is the iron triangle, the medicine's dilemma by William Kinzek. And with the iron triangle, we're always trying to balance access, affordability, and quality of care. Now, when we look at access on the continent, we know that the ratios of healthcare workers to the citizens or to the population is quite low. So you're looking at 2.3 health workers per 1,000 in Africa, and in Americas, which is made up of North and South America, you're looking at 24.8 per 1,000. Now you can see that's a ×10 difference, and they have similar populations, about 1 billion in Africa, 1.2, in the Americas, just under 1 billion. Now, another added effect is that when we now go to the next point where we're talking about chronic conditions and medical adherence, in Africa, 80% of all NCDs, or rather, the report by the medical journal, I think the BMC Medical Journal, they're talking about 80% of all NCDs, that's a non-communicable diseases, occurring in lower to middle income countries. Now, what opportunities exist here in AI? The key opportunity we see here is the ability to introduce personal health records, which allows people to have patient health generated data. I believe is one of the key strategies that should be looked into to leverage in Africa. Why? Because we have that challenge of that whole paper-based records, and we have the whole interoperability challenges within the health ecosystem. So that's one of the advantages. And then the adoption of smart devices. When we talk about smart health devices, which are becoming more affordable. Now, lifestyle diseases is on the rise in Africa. And so when you compare that to what is happening and you see the sort of challenges and the sort of things we have to deal with, it's a no-brainer that one has to start introducing these components. And AI as a solution doesn't work on its own. As you can see in this slide, I've talked about AI in there, but it's coupled with other technology solutions. It's coupled either with an emerging tech or a standardized mature technology solution. And then when we talk about scans, radiology and immunization, one of the key things when we look at these scans, COVID-19 pandemic really gave a knock onto maternal and child health on the continent. And as such, we have a situation where most of things like immunization and health assessments, they all took a backseat to an extent. Having said that, the rise of portable devices, like for instance, you have the ultrasound device by GE and Philips, which allows you to do regular antenatal checks, reduces the cost, gives us that input into actually achieving things. And then what do we do on that data? We have to train that data on African health generated data. And that data has to be coupled with the social determinants of health. In that way, we're now actually getting health interventions that are actually much more tailored to the continent. We're having personalized treatment tailored to the population on the continent. And the same thing happens with cervical cancer. There's a portable device, a colposcope by Mobile ODT. It allows these things to happen. So in my view, the opportunities are there, the technology is there, the willingness is there, everything is all in there to make it happen. So I'll just summarize with the last slide because I think I'm running out of time now. So on the last slide, I'm talking about how do we leverage these opportunities. In our view, a digital-first approach is key. Without this digital-first approach, we're not getting to a point where we have data. And without data, then we could all call it a day on talking about these emerging technologies. Data is the lifeblood and it's the first point of entry there. And then we're looking at skills and training. And that's one thing that the findings of the CR report, which Sonja talked about a few minutes ago, alluded to rather. But what's interesting here is that we have a high level of community health workers and nurses on the continent. Yes, we have the challenge of brain drain and everything, but imagine a revised approach where all these people are actually skilled on digital health interventions, digital health initiatives, and you're creating a big pipeline of digitally trained healthcare workers. We have to really recognize and appreciate our community health workers and actually look into a different model of working with our healthcare workforce. Then we talk about the health ecosystem. The interoperability level is staggering. We need standardization of data. We need open data policies, but we need more collaboration on the health care ecosystem. So we also having a standardized health information exchange platform. We're now in a better position to create data lakes that can actually sim all the data coming in, and we're now having a big data effect, thereby getting and positioning ourselves to really leverage AI. And finally, policies, governance, and advocacy. Open AI policy, I don't think we have one that is continent-wide. I know a few African countries are talking about it quite seriously, and some are in development, but we need a continental-wide AI policy. Why? Because anytime we're talking about AI and opportunities and technologies, we look at Africa as a continent. And I think on that basis, we have to look at open AI policy continental-wide. We have to look at open data policy, where we're looking at how data can be shareable, licensing restrictions, the principles, the rights, and then governance, especially accountability, transparency, equity, and inclusiveness. So to wrap up, I believe very strongly that there's a lot that we can do. The willingness has to be there. It's a digital first approach, and we're in a paradigm shift of AI driving everything. Thank you very much.
Thank you very much, Joel, for the great overview. And next up, we'd like to talk about drones. And Miriam, I would like to ask you to share some use cases with us you have seen in the for drones to support COVID response around the world. So over to you, please.
Thank you. I'll be happy to. Joel, that was fascinating. It's very interesting to see how many of these concepts like AI really cross modalities to move beneficial technologies forward. What we've seen during the COVID crisis is a real willingness on the part of aviation authorities to be flexible in allowing new applications for drone technology. As the pandemic has revealed new problems, governments are looking for new ways to solve these problems, and in some cases, drones have been able to offer an effective solution. There are a number of reasons for that, and I want to give a very brief overview of what drones can and cannot do to set some framework here. The drones that we're talking about in this context are small drones. So small UAV weighs less than 55 pounds. These aircraft are equipped with sensors that enable them to navigate, to avoid obstacles, to land, or to deliver to a defined target. They can be equipped with a variety of payloads, from cameras to thermal imaging and delivery payloads of different types for small and lightweight packages. Drones are inexpensive. They're relatively easy to operate. They can be environmentally friendly, and they don't require significant built infrastructure like runways and landing pads. Where drones do have limitations is that since we are, for this conversation, talking about small drones, their carrying capacity is limited. They can be weather dependent, and they have varying limitations on the distance that they can fly without renewing their fuel source, either recharging a battery or refilling another fuel source. So if you were driving a car, you would stop at a gas station. A drone needs to fly home and have somebody or some machine handle that for them. Because drones are a new technology, we do lack a robust framework of regulations around the world. As Sonja brought up in the beginning of the conversation, there's certainly more discussion needed on the ethics and any unintended consequences of the use of drone technology. However, that being said, there have been a lot of great projects that have taken place during COVID, and I'd like to share some of those with you. Some of the projects that we've seen have more staying powers than others. So we've seen a variety of projects explored as the crisis evolved. In the initial stages, when the medical consensus was that virus on surfaces presented a significant risk, crop spraying drones were adapted to spray disinfectant in large public areas. Drones do commonly carry thermal imaging payloads. In some cases, we saw those payloads used specifically to monitor body temperatures in large crowds in order to identify potential sources of infection. Drones have also been used by public safety officials around the world to monitor social distancing. They can be equipped with loudspeakers to enable public safety officials to remind crowds to disperse without having to interact in person. Those applications so far have had limited use. Certainly, by far, the most significant use for drones during the pandemic has been in the delivery area. If you could go to the next slide, please. Delivery is a very significant vertical for the drone industry because it has the potential for impact across communities. So it's not just affecting one particular industry, but it's really affecting all of the people who live in a community. Drone delivery has already been proven as a way to improve distribution networks in areas that lack a robust rail or road infrastructure. And those areas have really proven to be critical in driving the technology forward. So across the African continent, for example, we've seen incredible innovation in Rwanda, where Zipline has established a delivery network for blood supplies. They are delivering thousands of blood supplies daily to remote clinics, saving thousands of lives there. In Malawi, where a drone corridor has been established to enable additional tests of applications, but also to deliver HIV test kits for infants to and from communities and test processing centers. And in Ghana, where drone delivery is able to get vaccination supplies out to communities. Drones offer advantages in these places because, again, they are inexpensive to operate, they're fast, and they don't rely upon large landing and lifting spaces. During the COVID crisis, however, drones really demonstrated an additional benefit, and that's that they don't require human contact between the source and the recipient. So because of that advantage, we've seen many new drone programs proliferate. Drone delivery was used during the early stages of the pandemic in China to deliver food and supplies to quarantined areas. Zipline is now delivering COVID test kits to residences in Ghana. Similar test kit delivery programs are being trialed in the US. So what that is they have a small package that contains a test kit. Usually it's a swab, and they can deliver that directly to somebody's household. The person then performs the test on themselves, puts the sample back in some sort of packaging that can be delivered to a processing center without any contact between a person who's suspected to have an infection. In Europe and the US, drone delivery is also being used to get personal protective equipment to the staff in outlying clinics. It's a way of making distribution channels more equitable. So instead of delivering only to those areas which are most easily accessible and would have kind of the most impact by volume, you can deliver supplies in an inexpensive manner to outliers. There are also projects focused on delivering prescription drugs and retail items to vulnerable populations, such as older people. In the US, one of the largest delivery companies in the world, UPS, is working with major retail outlets like Walgreens to deliver prescriptions and other small retail products to people living in over 55 or senior communities. And that limits the need for those residents to venture out to go shopping and keeps them at home safely more often. Other companies, Google spinoff Wing is doing something similar, even providing services and delivery of things like library books for kids as schools and public libraries remain closed. You know, while those may not be from a medical perspective considered absolutely critical, what they are doing is providing a pool of data that will be used by aviation authorities around the world to establish the safety case for this type of delivery. What it does do as this pandemic continues, and we look forward to, unfortunately, the potential for similar pandemics, drone delivery could be really significant in keeping things operating and keeping communities going when they have to isolate at home. So drone delivery is making a significant contribution to COVID response efforts around the world. I think that what we'll see is that many of these trial scenarios that have been enabled during this unprecedented time, when authorities have a sense of urgency, will hopefully continue after the crisis is over.
Thank you, Miriam. That's a very positive outlook, and thank you for the great overview of the use of drones, particularly this year, but also in general for humanitarian response. And now we like to discuss one more emerging technology. I invited Lukas Borkowski from YAMO to talk about social behavior change campaigns. And Lukas, the floor is yours. I'm looking forward to your presentation.
Great, thanks a lot. Thanks for the opportunity and really fascinating discussion and presentation so far. If you could move to the next slide, please. Great, yeah. So unlike AI or drones, the technology that I'm speaking about is not so super advanced, but rather how we're putting it to use is advanced. So, you know, VIAMO is, or at VIAMO, we're working on mobile engagement globally. We sort of envision a world where all people have access to information and so that they can make healthy and prosperous decisions and have meaningful relationships. And for us, that's really overcoming information gaps. We believe information is power. And so how to bridge those information gaps in times of a global pandemic, in times of, you know, where even all of us were probably constantly checking our smartphones in March and April to understand what's going on and understand the latest news. So what about the billions of people that are not connected to the internet, that are living in rural areas and might not be even illiterate or only semi-literate? And that is really our bread and butter. And you know, we try to overcome this information isolation through the use of particularly IVR, interactive voice response, so voice-based pre-recorded mobile phone communication. It works on any mobile phone, so that we can give people like this woman on the picture here in rural Madagascar access to information so that she can call in and learn about what COVID is about, how to protect herself, how to protect her family, but then also looking beyond primary effects, even at secondary effects, how to continue growing her product, where to access government support and learn more about the onset. And all of that is behavior change communication, and, you know, tons of material about that available. But we all know that some some content, some topics are too complex to just convey in simple messages that people access. So we use a lot of path-based audio games and gamified content to bring COVID information across. And if you could move to the next slide, please. In essence, these are path-based audio games hosted on our existing toll-free numbers that we have in 20 plus countries in Africa and Asia. And it's sort of thematic stories with real life scenarios that are available in local languages and dialects 24/7, so that people can use them when they want, and through these simple mobile phones that they already have for free. And in those stories, in those audio games, we can blend in COVID information with agriculture, blend in COVID with family planning, COVID with gender-based violence prevention messaging, and essentially expose the caller to a short story. And towards, the story goes into different scenarios, and at the end of each scenario, the caller has the opportunity to make a decision. Do you think it's safe to give your friend the hand, or do you rather stay away? Do you think it's safe enough to send your children back to school, or do you rather keep them at home? Do you think it's appropriate to wait for more government support, or do you rather take things into your own hands? So it's sort of a decision-making sandbox for people to make decisions, and even learn about the consequences of certainly, risky decisions, and maybe not so positive decisions. And obviously, needless to say, these scenarios, these stories need to be adapted to local context. So not one game is similar to the other. We were pretty quick in putting them up in March. And we're now adapting them, or have adapted them with partners like CRS and others to the local context in a lot of those communities. And it's obviously digital. So even though it's not a moonshot technology as AI, it's still digital. So we have behavioral insights in real time. And we know on the second what people are listening to, what decisions they're taking. And it's a really powerful way to bring information across and let people learn about their decisions and what they should and should not do. If you can go to the next slide, please. So to give you an idea of the scale, that's Viamo alone, and we're working in Africa and Asia in about 30 or so countries with permanent offices. And these statistics are from yesterday. So far we've reached, on COVID content alone, about 17 million unique households. And those people have interacted with about, have listened to about 203 million minutes of COVID content on those hotlines and so on. There are a lot of other campaigns certainly available, but that gives you a scale, an idea for the scale of this information gap and information need, and why we are really focusing on that, and why we are innovating on that. If you could go to the next slide, please. Now, while we're still, we're still in this, we're still in the COVID situation, and I could pull up a lot more output statistics, and happy to do so. Happy us to link you to more content and information. But to give you a few ideas of impact surveys and work that has been done in the past, in the early days, on 1G games, how we call them, or these path-based audio games in agriculture, people have demonstrated a pretty high knowledge retention, an increase in unique knowledge acquisition, pretty robust. And the best thing is their behavior change, their intent to adopt promoted behavior even deepens with the extent to which they're exposed to the game. So in more simple words, the more often they play the game, the better they become, and the more they understand what behavior to adopt. So it is a really powerful way, with pretty high numbers for repeat callers on those games. And you can even use those games for recruitment and referral. From a game about climate smart agriculture and microinsurances in Madagascar, we converted about a quarter of the unique callers into into people that actually register to receive further information on this particular climate insurance. So it's a sort of a tool for promoting socially beneficial products, even in a more meaningful and more fun and interactive way than standard behavior change, even standard behavior change on mobile. If you could go on next slide, please. So because it's IVR and you know, because it's mobile, you can combine it with a lot of different aspects. So, you know, I just presented on these task-based audio games. You know, these audio games, again, they work on very simple mobile phones. So the dumb phones, you do not need smartphones. It's simple mobile phones. And you can combine these path-based audio games, for example, with paperless vouchers delivered through SMS. We combine a lot of audio games with remote learning campaigns and mobile-to-mobile surveys. You know, you can link them up to market linkage systems. You can blend the stories that are conveyed through the audio game with radio programming. That's what we do with a lot of different organizations. So it's a super interesting tool and you know, really modular approach. And I think that the key aspect here that I really want to bring across, we need to change the way we do behavior change communication. Going through mobile is great if you're already on that, you know, blending it with obviously field activities and radio and so on. But mobile alone is not enough to make this interactive, fun, and you know, really also meaningful and large scale. It needs to be gamified and needs to be modular and blended with a lot more other approaches. So I think that's the biggest learning we can share. So from this COVID onset, the most popular content we have out there is all gamified and interactive. Great, and if you could on next slide, please. So you know, all of that might sound great, but if you're up for fun, you know, try to note down that number here. From our demo line, you can use Skype. If you're not in the US or in the US, just pick up your phone, call that number for free, or more or less for free, I guess. That connects actually to one of our hotlines that's in live operation in Uganda. That's available in local languages, but also in English. And you know, make sure to play one of the 1G games that's on that hotline to really get a feeling for what that feels like and understand the impact that this approach can have for your programming. Thanks a lot.
Thank you very much, Lucas. I'm definitely looking forward to give that game a go later. Thank you very much to our speakers for sharing 3 very different emerging technologies. And yes, Lucas, you mentioned interactive voice response. So IVR is not really a new technology, but certainly the gamification aspect you shared is very innovative, and I think does count as an emerging, well, at least application of an already existing technology. We have a number of questions in the chat, so thank you very much for those, and feel free to keep them coming. Even if we don't get through them, we will pass those questions on to the speakers. A number of the questions have been around funding and the costs of these technologies. So just want to prepare all our speakers. I want to ask you each about the cost aspect of your technology. And Joel, I would love to start with you. So there were a number of questions, particularly around the cost of AI and what about the investment scale, and what are the specific challenges you faced when installing telemedicine and how you deal with it?
Okay, thank you very much. Well, it's a difficult question to answer in the terms of the cost varies. As you know, it really depends on the requirements of our clients and what they really want to do. But what we have found when we're looking at costing AI solutions, it really depends on if we're using an off-the-shelf AI solution, and then we're now going to customize. So in that case, you can go software as a service, which makes it reasonably cheaper. And then we look at other solutions where we can start from the 25,000 USD back and go further up when we have our integrated team. So in most cases, when you're looking at customization or developing the solution, it's important to bring an AI ethics on board because AI bias has to be addressed. So by the time we bring in all the relevant skills and the planning and actually mapping back, those ones can increase the cost. And it depends on the maturity level of the organization we're dealing with. In an organization that's fairly mature and actually have a digitized outlook already, there's less prerequisites and back work we have to do before developing. So when you take the various things on board, it really changes things. Then the other question about telemedicine, we don't install telemedicine solutions. What we are doing next year is that we have a personal health record system which allows individuals manage their personal health record, which we're now upscaling to link into various health devices. So we have a partnership with iHealth Labs where we're linking all their devices to that. And then also we're looking at developing a telemedicine platform onto that. And that will be software as a service, which will be quite accessible to healthcare professionals and providers in Africa. But that is something we're looking at doing Q2 next year. Okay, I hope that answers the question.
Thank you, Joe. Miriam, I have a similar or same question for you. I know talking about the cost aspect of drones is a difficult one because again, it's a large scale of what kind of a drone or drone program we're talking about. But are you able to comment a little bit about the funding or the costs of drone initiatives for humanitarian response?
Sure, absolutely. I think that it kind of depends on what you are comparing it to. So I would say that it's extremely cost effective because if we say that drones do a good job of, if you'll forgive the word, democratizing the airspace, making the airspace more available to more people, because if compared to a sort of manned aircraft response of any kind, it's vastly less expensive. But even on just sort of an objective level, small aircraft are less expensive. So when you say for humanitarian purposes, again, it's anything from mapping projects or search and rescue projects or things like that to drone delivery. But you are talking in this sort of less than $50,000 range in general, as opposed to more than that. And when you think about things like, with apologies to any of my friends at Zipline, I'm going to use them as an example. When you think about things like the Zipline project in Rwanda, which is an incredible project that does thousands of flights every single day to deliver blood supplies to remote clinics. If you were to compare the cost of one of those drone flights to the cost of the traditional way of doing it, on a scooter or something, a part of the time you wouldn't be able to use the scooter at all. And the drone flight is probably less expensive. However, they needed the support of the government to get that started, get that infrastructure in place, train a local workforce to do that, and so forth. So compared to any sort of manned aircraft response, it is incredibly cost effective. It can be done cheaply when drone delivery is more broadly accepted. Would a hospital be able to buy a drone and use it for $10,000? Absolutely, probably. But there's more work to be done before we get to that point where anyone can just go out and buy a drone and fly it for drone delivery.
Thank you. Lucas, the same question for you. We have a question. How affordable is the IVR application for widespread use?
I guess, IVR is extremely applicable, particularly you have larger audiences. So, and it's always similar to what Miriam said, always the question, how much would it cost through traditional approaches? So, for IVR, you certainly need a few things like a ideally an integration and framework contract with mobile phone network operators. And, that's something that VMware can fix for you. And then a mobile engagement platform to really design the campaign and so on. We got that covered too. So in the end, the cost of basically, apart from setting a campaign up, but the cost of delivering information is just a few cents per minute. And, in most instances, we, have established across the board in 20 or so African and Asian countries framework contracts with mobile phone network operators where we make these behavior change campaigns actually available for free to the end users, and the telcos are covering the airtime cost. So that is actually, not making a huge difference if you reach 100,000 or 1 million people, so or 10,000. It is an affordable technology in terms of usage cost. It's, when we run remote training campaigns, for example, another thing we do, it costs a fraction of what it would take to go out and, meet people on the ground, because you can bridge distances. You can do it remotely. People can stay where they are needed. So there's so many opportunity costs even that that you have with traditional programming that do not apply to IVR approaches. So it's not just a question of how affordable that is, but also how much of a cost saver it is. And we very often speak to our partners who are able to reach a lot more people, get a lot more bang for the buck, thanks to IVR approaches and the strategic use of IVR and the programming.
Thank you, Lucas. There was also a question about if the IVR application can be used on any type of phone. I think your colleague Samuel has already highlighted that it is even including basic flip phones and of course any type of smartphone. So it is a very inclusive technology, which was one of the questions as well around inclusivity, and that brings us also a little bit to, as we mentioned earlier, ethical considerations and diversity and equity. And Joel, I wanted to ask you if you are interested in sharing a few thoughts on the ethical considerations around AI. I think you mentioned it earlier in your slide around the report. What are your thoughts on this?
Okay, no, there's quite a bit that has to be looked at when we talk about ethical considerations. Now, the key thing about AI development is that we're looking at AI by defect is actually human intelligence. So you find out that you have to be cognizant of the fact of transferring human bias into the algorithms you build. So one of the key things we do is ensuring that we have a multifunctional team from the onset. And AI ethicists is involved. We have people from the compliance, governance, and legal. And then we really look into things like the GDPR components if we're dealing in Europe, and also in South Africa, the POPI Act, which is the Personalized Information Act, similar to the GDPR. And then understand what the data is being used from, and then also consent, especially if we're looking at people's personal health data coming on board in this, ensuring that we close that whole loop. So yes, it's very important, and those sort of initial dotting the I's, crossing the T's before you actually start the project is quite time consuming, but very important to do before starting out. So that's the way we approach it. We ensure that from top to bottom, there's an understanding. That way, before we now go into speccing, development, and everything, we know that we're working with a very clear mandate of what we have to do. Okay.
Thank you, Joel. And Miriam, you already mentioned earlier that the ethical consideration around the use of drones is very much to do with the policies and the partnerships of the governments. Would you like to explore that a little bit more?
Sure. There are a lot of ethical considerations when it comes to drone use, certainly by law enforcement agencies. so those questions, on the one hand, they can provide a lot of safety for communities. They can kind of prevent law enforcement from entering a situation without sufficient information to be able to guide their response. But there is certainly concern about the use of drones from a law enforcement perspective. There's also a lot of concern about the use of drones, which by their nature almost always carry imaging facility, and they carry imaging payloads for multiple reasons. Um, in the delivery context, it's for navigation, right? But in many contexts, drones are designed to be a flying camera. They're designed to perform mapping and inspection processes. And while there are a lot of advantages to doing that, that also raises questions. And those are the same questions that we see raised with things like facial recognition technologies and so forth. Additionally, there are issues of private property, which are very difficult to sort of tease out. This is a new technology and it hasn't been tested before. And the issue is, do you own the airspace over your home? Or how high should you own the airspace over your home? You know, should you be able to say, I don't allow a drone to fly over my home? You can't say that you don't want an airplane to fly over your home. You know, to what altitude do you control the airspace over your private property, and so forth. So those are additional considerations that communities are very concerned about. Should they be able to limit the use of drones around certain areas, such as schools or public parks? So all of those things are sort of negotiations. They are a process of education about kind of what drones can and can't actually do. We need to work on eliminating kind of misconceptions. And I think the drone industry is also very, very aware that they need to be open and sensitive to the very legitimate concerns of communities about drone use, and kind of work on implementing them in a way that serves communities and doesn't put individuals' privacy or rights at risk.
Thank you, Miriam. And Lucas, I imagine that the IVR can certainly be used to address concerns around inclusion and diversity and equity. So maybe that is the combining aspect of this. We're pretty much out of time now. I just wanted to first of all thank our speakers for your very insightful contributions. And I also would like to make a brief announcement of a ICT4D Partnerships Conference that we have organized for January 12th. So this is a free to attend virtual conference that will bring together individuals representing organizations involved with ICT4D or digital development or the use of digital tools for humanitarian response. We will discuss new partnership models, how to better support local partners, particularly now in the time of limited travel and in-person meetings. We'll discuss ethical considerations, particularly around AI and ML and health data sharing. And also we'll have sessions on how we can better team up for capacity building and create data literacy. And generally, it is, like many ICT4D conference sessions, a multi-sectoral approach and very inclusive events. So I'm hoping we can see many of you. And I will share the link in the chat as well. And before you leave, please do fill out the feedback survey from NetHope and let us know what you thought about this webinar. And I wish you a wonderful rest of your day. Thank you.
Thank you, Sonja, and thanks to our audience for attending today. As Sonja mentioned, please fill out our survey. We love your feedback, so please take a moment to to give that feedback to us, and look for that follow-up email with a link to the recording for this session and other links and collateral to information that we learned about today. Thanks to our presenters, and have a great rest of your day.